are you all? I hope you all are doing fine. So I'm back today with a new topic. The topic that we are covering today is why do we fall in?
So, why do we fall in? Sometimes we know the reason, and sometimes we really don't know why we actually fall in. So, what is health, and why we are talking about health, and why the health is so important? Let's talk about it. So, health is a state in which we are mentally, socially, and physically fit. So, this is the definition. But before we describe the definition or what is the meaning of this definition, the question is that why we need good health. Let's try to understand this. For example, now, I'm a teacher. If I'm not physically fit, maybe I have headache or maybe I have cold or flu or whatever it is. So, if I have any type of illness, I cannot give my 100%. So that is why, and it's not about me, it's for everyone. So health is important for all. But what is this health? Health is a state in which we are mentally, socially, and physically fit. Mentally means we have a peace of mind. Socially, we are connected with other people. We are maintaining social harmony. Physically fit means we have no physical illness. So when we are mentally, socially, and physically fit, then we can say yes, we are in good health. So if I elaborate this topic health a little more, there are few factors which actually affects our health. Now these are, the first one is food and diet. The type of food we eat actually contribute a lot to actually give us a good health. So there are few factors on which our health actually depends on. So the first factor is food and diet. So when I talk about food, now everyone knows when we talk about food, the food which is rich in proteins, vitamins, minerals, carbohydrates, and fats is a good food. Good food is very important to stay healthy. Second, if I talk about, then it is exercise. Exercise is very important. Now, you'll say now we are sitting in a lockdown period and we cannot go out. So how is this possible? Yes, it is possible. Even if you have very limited resources, even then you can do exercise. Third, family and friends. Family and friends, they play a very important role in our life. So it's very important to connect with them. Fourth, sleep. Yes, sleeping for 8 to 10 hours every day will keep you in a good health. And the last and very important is the stress management. So if I talk about stress management, now if I talk about today's life, everybody has a type of stress. Students have different type of stress. They have stress related to studies, and other people have different types of stress. Now it depends on us that how we manage this stress, because this stress can really lead to various types of disease. So, because when you take stress a lot, the different hormones which is present inside your body and which are actually regulating each and every function inside your body, they get disturbed. And once they get disturbed, then definitely one or the other type of disease will get. So, it is very important that we manage our stress. Now, if I talk about or if I distinguish different types of disease, there are various types, but before I distinguish them, let's talk about what is the meaning of this word disease. So, if you see this word disease, it is made up of two words, dis plus ease. That means without ease or without comfort. So, whenever we feel like that we are not in a good state, we are not feeling comfortable, we then we can say that yes, this can be a sign of disease. So, before I discuss the diseases as well or the types of diseases as well, let's talk about a little bit about what are signs and what are symptoms. Sometimes it happens that maybe when you are at home and maybe you feel headache or nausea or vomiting, sometimes of these type of signs we can feel. So we can say like maybe there is a type of disease inside our body, and sometimes it's not sure, we are not sure that we actually have a disease or not. So when we will And if somebody has headache, and this headache, and that person actually takes a medicine, and that headache goes after an hour or so, that means that person is fine after some time, then it's okay. But the problems comes when that headache persists for a couple of days. In that situation, that person needs to visit a doctor. So when he'll go to the doctor, and he'll be visiting a doctor, then the doctor are going to ask so many questions. The question will be, okay, now you have headache, how many days that you are feeling the symptoms of you are feeling this headache? Then is there any other thing that you are feeling, or is there any specific region or the area in your head where you are feeling this headache, or it's in the complete head, or are you feeling nausea or vomiting along with this headache? So these type of questions going to doctor is going to ask. So doctor is actually looking for the symptoms. So this is the basic difference between the signs and the symptoms. Now, if I talk about the type of diseases, diseases are of many types. First type of disease is acute disease. So, if I talk about acute diseases are the diseases which actually stays for a short span of time, like common cold that we actually feel maybe once or twice in 1 month or 2 months, or normal cough. These are the things which maybe stay for 5 days or 6 days, for a very short span of time. So these type of diseases are known as acute diseases. So if I talk about chronic diseases are the diseases which stays for long span of time. Like if I talk about tuberculosis, if I talk about AIDS, if I talk about elephantiasis. Now, what is elephantiasis? Now you can see the in this picture. If you see, the legs of this person is really very swollen. This is actually happens with the mosquito bite, and in this case the legs of these persons swell up badly. So this is elephantiasis. So the diseases which stays for long span of time, these are known as chronic diseases, and sometimes these are really very dangerous too. So the question is, sometimes we forget that how we remember that what is the difference between chronic and acute diseases. So simple method is, so if you see the word acute, ACUTE, it has 5 alphabets. Shorter word, staying, that disease is staying for a short span of time. Chronic, it has 7 alphabets. So the disease is chronic, and the method is to remember, more alphabet, the disease is going to stay for a long period of time. So when we talk about infectious diseases, what are infectious diseases? The second name for infectious diseases are the communicable diseases, or the simple way, the diseases which can spread from one person to another easily. Very common example that we see every day in our life, that is common cold, cough, and the most popular and the common example now that we are seeing in lockdown is the coronavirus. So that is why we are sitting inside our houses. We are not stepping out, because this disease can easily, or corona can easily spread from one person to another. So all those diseases which can spread from one person to another are known as infectious disease, or communicable diseases, or contagious diseases. Now, if we talk about that how these diseases actually spread, so there are various factors, or there are various agents through which all these diseases actually spread from one person to another. So if we talk about all these types of agents, then these are viruses, these are bacteria, these are uh, fungus, or can be protozoa, or can be worms, which actually spread diseases from one person to another. So if I talk about viruses, like corona is also a virus. So common cold, that is through your rhinovirus, influenza through influenza virus, then measles, mumps, chickenpox, AIDS, hepatitis, these all are viral diseases. So they spread through the microorganism which is called as virus. Now bacteria, if I talk about the different examples, cholera, typhoid, tuberculosis, tetanus, anthrax, food poisoning, all these actually spread through bacteria. Then fungus, all the skin infection that you see, it can be, there are many people who just scratch their skin again and again. It can be eczema, or it can be any other skin infection, or it can be, ringworms. When you see different types of patches, red patches on the skin, which is called as ringworm, they all most of the skin infections, they spread through the fungus only. Now, if I talk about protozoans, then malaria, kala-azar, or amoebic dysentery, sleeping sickness, which is, if I talk about specifically about this amoebic dysentery or amoebiasis that spreads through amoeba, and sleeping sickness, that there is a there is a protozoa called mycoplasma that is responsible for this sleeping sickness. So these are also, the diseases which spread through protozoans. Now, when we talk about worms, so there are many worms which are responsible for spreading of many types of diseases. For example, in many type of intestinal infections. For example, if I talk about hookworm or tapeworm, they whenever we sometimes we eat that food, or sometimes they enter inside our body and they just go inside our gut and they just stick over there. So these are basically intestinal infections and given by the worms. So now if I talk about non-infectious diseases or non-communicable diseases, so these are the ones which do not spread from one person to another. Like, sometimes these, many times these diseases are genetic. So for example, if a baby is born, and that baby has maybe a hole in the heart, so that is genetic. So this is not going to be communicated from one child to another or one kid to another. Likewise, if I talk about diabetes, diabetes is a lifetime disease. So if a person or if a baby is actually born with diabetes only, so that diabetes is going to stay for life. So if you actually notice these type of diseases, non-communicable or non-infectious diseases, these are genetics. And the reasons, if I talk about, the reason can be unwanted growth of cells that can lead to these type of diseases, or this can be genetic, or there can be hormonal disturbance or deficiency of vitamins or proteins. They actually lead to non-infectious diseases. So again, like I talked about, there can be any type of deficiency. This deficiency can be vitamin deficiency, can be hormonal imbalance that can lead to all these non-infectious diseases. Then, if a person has allergy, or a person is hypersensitive, towards a certain material, that can lead to any type of allergy. So the people have asthma, or the children have asthma, that is completely a non-infectious one. That child or that person is not going to communicate this particular disease to anyone else. So that is why this disease is coming under this non-infectious category. Then cancer. Now, what is cancer? Cancer is just the unwanted growth of cells. So it is completely regulated inside our body. So a person who has cancer, any type of cancer it can be, that cancer is not going to communicate to any other person. Then we talk about mental disorders. So if a person has depression or anxiety, that is not going to transfer to any other one. So this is a non-infectious disease. Then there are many example we can talk about. People have many type of addictions, alcohol, or it can be drugs. So these are the non-infectious diseases. And then the last one is degenerative. Sometimes sometimes a few babies are born with, they have some dysfunctional organs. Maybe the heart is not working properly, or a part of brain is not working properly. So these type of diseases or these type of symptoms show that these are non-infectious diseases. These are not going to uh, communicate to any other person. Right. So who is spreading these diseases? So first and the foremost agent is through air. Now, how these diseases spread through air? Let's talk about a very common example. For example, if a person is coughing, or if a person is sneezing and I'm just standing near to that person. So there is a possibility that when that person is sneezing, a few droplets are coming in the air and I'm inhaling those droplets, or few droplets can come onto my skin, on my hands, and maybe accidentally I can put my hands, those hands without washing, into my mouth. So what I'm doing in this case, so the virus which is present in the air, like if I talk about this common cold, that spreads through a virus, and that virus comes into the air when a person is sneezing. So when I'm inhaling that, so that virus is entering inside my body. And if my immunity is not strong, then definitely I'm going to have the cold again, right? And like if I talk about tuberculosis, that is TB in short form, we say that is spread through a bacteria. It's again, it spreads through air. So if a person has TB and we are in the contact with that person directly, and when that, and somehow we inhale that air in which that person is breathing, and we are inhaling the same one, we are in close contact with that person. So what will happen? Finally, we are inhaling that bacteria. That bacteria enters through the nose, that finally goes into the lungs, and forming again, a person will get tuberculosis. So the most common example you can see, like corona. So when a person has corona and that person is again coughing or sneezing, and you are coming in contact with that person, then you are inhaling the virus and you are taking the disease. But how? It's through air only. So this is how different agents can spread through air. Now, through water. How diseases spread through water? Examples: cholera, amoebic dysentery. But how? What happens, for example, if a person has cholera, or if a person has um, amoebiasis, then what happens in that case? Sometimes it happens that uh, the stool of that person accidentally mixed with the groundwater, and that groundwater is, if that groundwater is mixing with the drinking water, and a person accidentally drinking that water, so what is happening in this case? That finally that person is inhaling um amoeba, or that person is inhaling the bacteria which is responsible for cholera. So if, and once that amoeba or once that bacteria enters inside our gut, then definitely it's going to mm, create a disease inside our body. So this is how the diseases spread through water. Now vectors, like we talked about few slides back as well, that how, what are vectors? Vectors are just like a courier service. For example, if I have a courier and I want to send this courier from wherever I'm staying. For example, if I'm staying in Gurgaon, I want to send that courier to Delhi. So I'll be needing a person, I'll be needing a courier service, and that courier service will take the packet from me and deliver to that particular address where it needs to get delivered. So vectors are like that only. So vectors actually transfer the pathogens or the parasites to the host. So, and mosquitoes, especially if I talk about malaria. So in malaria, what happens when the mosquito, especially the female Anopheles mosquito, when this mosquito bites, so it sucks the human blood, because female Anopheles, this mosquito needs human blood so that that particular mosquito can lay egg. And the virus which is responsible for malaria is present in the salivary glands of this mosquito. So when this mosquito is biting, so basically this mosquito is liberating the particular virus into the human blood, and the person will definitely get malaria. Now, if I talk about the diseases which actually spreads through the intimate contact, that is through sexual contact diseases, these are AIDS or syphilis. So what happens in that case? That virus actually enters inside our body. And if a person or if a mother has AIDS, then there is a probability that the same virus can be transferred to the baby as well. But there are few myths. If I talk about AIDS only, which is a viral disease, if you are coming in contact with a person who has AIDS, but if you are shaking hand with that person, you are just sharing the same utensils, you are just sharing the same swimming pool, or sharing the same toilets, or same clothes, or maybe you are traveling together. In those all these cases, the AIDS doesn't spread. AIDS only spread from one person to another only in two cases. One, if there is intimate sexual contact, or if accidentally that person has used the same syringes, same needle which was used to a person who has AIDS. Now, another thing that we talk about here, organ specific and tissue specific manifestation. There are different means through which any type of vector or any pathogen or any microorganism enters inside the body. So, once the vector or a pathogen or a bacteria or a virus entering inside the body, if it is going to affect a particular organ, then it is called as organ specific manifestation. And if this particular microorganism or virus or bacteria, whatever it is going to affect a particular type of tissue, then it is known as tissue specific manifestation. For example, if I talk about the bacteria which is responsible for tuberculosis. So, tuberculosis is a disease in which the germ or the bacteria enters through the nose and finally goes into the lungs. Right? So, this is organ specific manifestation. So, now the next topic comes to what is the principle of treatment. So, basically, there are two ways. One is to reduce the effect of the disease, and second is to kill the microbe. But the question is how to reduce the effect of a disease, how we can reduce the effect of a disease. Sometimes it happens, for example, if a person has, viral fever and lose motions or pain in the body. So, what that particular person does, that person takes some medicine, maybe crocin or calpol, and person will take rest for a couple of hours and conserve his energy. Then what will happen after some time? That he'll be fine. So this is one way. Here we are just reducing the effect of the disease. And second thing is to kill the microbe. Now in this case, what we are doing, whatever microbe is actually attacking our body, we are killing that microbe. For example, if I talk about any bacterial infection, if I talk about typhoid, or if I talk about cholera, or if I talk about tuberculosis. So, bacteria which is responsible for typhoid or cholera or tuberculosis will will visit the doctor. Doctor will prescribe some medicines, and that particular medicine is the antibiotic which will work against this particular bacteria. We'll take the antibiotic, and after the course of that antibiotic, it can be 3-day course or it can be 5-day course. After taking the course of those 3 or 5-day course, we will be fine, because what that antibiotic is doing inside our body, that antibiotic is actually killing that particular bacteria inside our body. So when we talk about all these microbial agents, for example, bacteria only, all these bacteria have particular chemical pathways. So what these antibiotics does, these antibiotics actually break that particular biochemical pathway, and finally the bacteria dies. So this is how antibiotic works. Here, one very important thing to notice is, specifically when we talk about viruses. So if I talk about corona, or if I talk about normal flu or normal cold. So if you visit a doctor in normal cold, so sometimes it happens that doctor prescribes antibiotics. But the important thing is, viruses can't be cured with the help of antibiotics. So for the normal viruses, our body actually creates or generates interferons which fight against those viruses, and we are fine. For example, if I have cold and I'm not visiting any doctor, I'm not taking any antibiotic, because antibiotic is useless if I have cold, because that antibiotic is not going to affect that virus. So, but after 5 or 6 days, I'll be fine because my body is, my immunity of my body is fighting against that particular virus. My interferons are fighting against that particular virus, and I'll be fine. So again, this principle of prevention can be general or can be specific. So there are few general ways of prevention. So if the first is the public hygiene, if we maintain hygiene, maybe in our houses, maybe in our surroundings. So if there is no kachra, there is no garbage nearby, and there is no garbage in our house, then yes, there is a huge possibility that we we don't actually get any type of disease if we are actually maintaining a complete hygiene. If we are washing all the utensils properly, we are washing all the vegetables, fruits properly, we are cleaning our house properly, and we are cleaning our surroundings, we are maintaining hygiene in our surroundings as well. So yes, there is a less possibility to get any type of infection. Then yes, nourished food. Second is a proper and nourished food. You know what happens if I talk about human body? So human body has a tendency. It's a natural tendency which we say as immunity. So every person has immunity which fight against any type of infection. And how we build this immunity? If we take proper food, if we take the food which is rich in protein, vitamins, minerals, carbs, fats, each and every nutrient is present in our body in a proper amount, then our immunity gets stronger, and our body, or the WBCs which are present inside our body, or the immunity gets, we are inside, we are healthy from inside, and we get resistance against the diseases. Likewise, if I talk about the airborne diseases, we need to we need to avoid the crowded places. We need to avoid that particular person who has some type of infection. Waterborne diseases, again, you need to have the water that you are drinking. It is very important to to keep a check that the water that you're drinking is completely safe. Then vector-borne disease can only be prevented if you are maintaining hygiene around yourself or the surrounding is clean. Then specific ways of prevention. Now it is very, very important. What are the specific ways of prevention? You know, if you have noticed, you must be noticed, like, when a baby is born in the hospital, before that mother leaves for her home, a chart has given by the doctor, and that chart says the different types of vaccines that needs to be given to that particular baby with time to time. So what are these vaccines and how these vaccines are preventing us from many type of infections, or how we can prevent ourselves with the help of these vaccines. So what are vaccines? First of all, vaccines are the thing in which the lethal form or the attenuated form of a particular microbe is given to a person, so that the person develops antibodies against this vaccine. So basically, what we are doing, we are just fooling our immune system. We are just giving an antigen in the form of vaccine. That antigen is lethal or attenuated form, which we are injecting, or we are taking that vaccine, so that our body can generate antibodies against it. Then what happens in case in life, if that particular comes in contact with that particular microorganism which is responsible for a particular type of disease for which that person already had the vaccine at times, then automatically or already the antibodies are present inside the body. So if a person is getting that infection anyhow, that automatically the antibodies will fight against that infection and will be fine. So this is how all these vaccines work. But on top of that, when we talk about vaccines or any type of drugs or antibiotic, it is very, very important to eat healthy to stay fit. Because when you are eating healthy, you are eating right. The diet which is rich in proteins or vitamins or minerals and carbs and fats. So your innate immunity, that means the body which is, with the help of which your body can fight against the disease, that gets stronger, and you can fight against so many types of infection. You can see examples. If a person is having cough, and there are 5 person are sitting near to that person, but it is not necessary that all those 5 persons will get cough. No, the one who has poor immunity will definitely will get that cough. Likewise, again, if I summarize everything together here with corona, like nowadays we are seeing, we are noticing many cases of corona which are asymptomatic. There is no symptom. The people are not having a single symptom of corona. Still, they have coronavirus inside the body. But how is that possible? Some people are just dying on hospital beds, and some people have corona, but the corona is not infecting. It's completely asymptomatic. How? Because the person who has coronavirus, but he is asymptomatic, that means the immunity of that person is very good. And how innate immunity, or how this immunity can be good? When we eat healthy, when we eat good. So eat healthy and stay fit. Thank you.
Thanks for watching the video, guys. If you have any query, any question, please write in the comment box. And if you like the video, don't forget to share it. Thank you.